Congenital heart disease involves structural heart or vessel abnormalities present at birth. CHD constitutes almost 1/3 of all congenital defects. This makes it the most prevalent congenital anomaly. There are two main defects: septal defects, also known as a hole in the heart, and coarctation of the aorta, or narrowing of the main artery. The exact cause of congenital heart disease is mostly unknown, but it is presumed that genetic and environmental factors may increase the risk of CHD. There are two types of congenital heart disease. The first one is acyanotic CHD. This refers to a defect that doesn't significantly affect oxygen levels but can still cause abnormal blood flow. Two examples is atrial septal defect and ventricular septal defect. The other type of congenital heart disease is cyanotic CHD, and this refers to a defect that causes oxygen-rich and oxygen-poor blood to mix, leading to lower oxygen levels in the body. Two examples of that is hypoplastic left heart syndrome and interrupted aortic arch. Here you can see the difference between atrial septal defect and ventricular septal defect. They are similar in the way that they both refer to a hole in the heart, but atrial septal defect occurs between the upper chambers or the atria, while ventricular septal defect occurs between the lower chambers or the ventricles. These are both examples of acyanotic heart disease. Here you can see the difference in blood flow through a normal heart compared to one with cyanotic heart disease. The diagram on the left shows the mixture of oxygenated and deoxygenated blood in the way that it flows through the heart with hypoplastic left heart syndrome. And the one on the right shows the blood flow through a heart with interrupted aortic arch, showing the division in the aorta. The signs and symptoms of congenital heart disease may differ in infants than in older carriers. Infants may show signs of poor eating, tachypnea, lethargy, and cyanosis, while children and adults may experience faltering growth and development, dyspnea, cardiac murmurs, and respiratory infections. Medical professionals diagnose congenital heart disease through various methods, including physical examination, imaging of the heart using ultrasound, X-ray, or MRI, recording the electrical activity of the heart, or using a pulse oximetry to measure the oxygen saturation in the blood. Treatment for congenital heart disease depends on the specific defect and its severity and can range from simple management to surgical intervention, but all cases require long-term care. Thank you for watching and learning with me today. This information was obtained by reliable sources and are listed here.